And you may have noticed that these numbers up here, these trends, look pretty good, right? The total number of tests is up by 5% over last year. The total visits is up. They're now doing more tests per visit than they were last year. All of that is great. But you see this number over here that says that average tests per device is down, and down pretty significantly, right? If we come down and look at the average tests per device, you can see exactly where it dropped, right? So we went from July of 25, where there was 450 tests per device in that month. And then you can see it drop significantly in August. Now, if we look at the total tests, you can see that if you look at July, there were so many tests run in July. They ran 43% more tests in July than they ran in June. So what happened here was this practice was growing, right? And they saw that they were running more tests. They had more patients coming in, and they started to run into bottlenecks. And we see this a lot more with folks who are using the Humphrey versus the Carrot. But it can happen if your volumes are so high. It can happen even with a device that is so flexible and so fast. They started seeing some bottlenecks. It was causing them to slow down a little bit, and they couldn't maximize the number of patients that they were seeing. So when they had this huge increase in the number of tests and the number of patients that they were seeing, they ordered another Carrot. And so if we look back at the average tests per device, you can see that, it's climbing. It went up, this huge chunk. And then they purchased a new device, and you can see it levels back out again to about their average. So this is all to say that, when you see a bottleneck in your practice, there are ways to overcome that. And sometimes it's, changing the way that you are moving patients through your practice. Sometimes it's in scheduling. And in this case, it was adding an additional device so that they could get additional patient throughput. Had they or we been able to really see this data and see these huge jumps, I think, it becomes really clear where you can see like, wow, that's a lot of tests for one device. Maybe we need another one.